And so today we gather here to harvest the results of these collective experiences and together chart a way forward for our nation's future. We are here to collect and build on the best practices that we have all recorded in the last 6 months. So today, if you are the custodians of best practices in the fight against COVID-19, you must remember that best practice is never implemented retrospectively. It must be applied instantaneously. Timely and instantaneous implementation of what has worked is what will take us forward and most significantly secure the gains that we continue to make. But as we implement best practice after council of this conference, our shared goal must also remain in sight. And this goal is simple: victory over COVID-19 and nothing else. And we must achieve it with zero option. And to achieve it, we must begin by building positive resilience. We must move away from tactical response to this pandemic to strategic response. Instead of symptomatic reactions to this crisis, we must move to structural reactions that are long-term and transformative. And this is what I call positive resilience. Being able to anticipate the patterns of this pandemic and responding to it transformatively and building back better. Without a doubt, we need as a country to re-engineer ourselves and to really focus on preventative healthcare. Not just wait for things to get to a critical stage, but to prevent them before they actually happen. This must be the focus, and this must be the base of our universal healthcare going forward. I think, governors, you will agree with me that as a result of some of the measures that we have taken during this particular COVID pandemic, we have seen a massive decline in waterborne diseases and the problems that have affected our people in the past as a result of cholera, bilharzia, and other waterborne diseases. All these issues related to cleanliness, we have seen a huge reduction in the number of cases that are being reported in our respective hospitals as a result of the actions that we have taken on COVID. So mine is to encourage us and to say that as we move forward, some of these positive measures that we have adopted during this pandemic should become the new normal, should become the new Kenya, should become the way we move forward. And we should incorporate and build upon these as we continue, as indeed was said, to strengthen our capacities, especially in our community workers, in our health workers at the grassroots levels, to be able to help us ensure that we are able to prevent before we need to get to the cure. Allow me now to suggest a framework for banking your experiences of the last 6 months in this conference. This framework has 3 elements. First, I want us all to do a post-mortem analysis of how we have handled the COVID-19 crisis 6 months after it began to manifest itself in our country. Begin by looking at the forecasting of the spread of the virus. If all our models had projected severe scenarios that did not happen, was it because we were forewarned, or was it because of the swift interventions that we put in place? How does our national response compare with others within the region, the continent, and the world? Is there something that we could have done better? And are there lessons we should carry with us to the strategic phase of this war? Ladies and gentlemen, And I am not asking you to ponder these questions because we have failed. To the contrary, I believe we have done remarkably well, and that is why we have begun to flatten the curve. But to do better, we must remain brutally honest with our approaches, because intellectual honesty is critical to building resilience going forward. Ladies and gentlemen, secondly, after doing a post-mortem analysis, I invite you to do some in-mortem analysis. Ladies and gentlemen, we are in the middle of a crisis, as you all know, and we must analyze as it unfolds and changes form. The good news, though, is that in the middle of this crisis, the curve is beginning to flatten. However, we must not celebrate this happy moment too soon, but rather celebrate it with a great deal of caution. More so because the curve begins to flatten after it reaches its highest point. This point is also called the inflection point. And it is the most dangerous point because the curve can either flatten and de-escalate or take an upward surge. My appeal to all of you as experts, practitioners, and leaders is therefore to deliberate on our in-mortem condition. Although the curve, as I said, is beginning to flatten, could it surprise us by taking an upward surge at this inflection point? My third invitation to you, ladies and gentlemen, is for you to do a pre-mortem analysis. This is about early warning, but more fundamentally, it is about long-term response. If indeed we are to shift our response from tactical to strategic interventions, we must do a simulation of how this will work. A shift from symptomatic response under COVID-19 to structural response under universal health coverage must be well thought out. How, for instance, will the environment respond to this shift, and what are the enablers and disablers of this undertaking? Pre-mortem analysis will help us chart the path to sustainable health provisioning for all. Using this model, the conference should therefore give us counsel on how to promote preventative medicine over symptomatic care. It should guide us on how to use the lessons learned from the COVID-19 experience in order to anchor the full national rollout of the universal health coverage, one of the pillars of my administration's agenda for the nation. Without a doubt, we need as a country to re-engineer ourselves and to really focus on preventative healthcare. Not just wait for things to get to a critical stage, but to prevent them before they actually happen. This must be the focus, and this must be the base of our universal health care going forward. I think, governors, you will agree with me that as a result of some of the measures that we have taken during this particular COVID pandemic, we have seen a massive decline in waterborne diseases and the problems that have affected our people in the past as a result of cholera, bilharzia, and other waterborne diseases. All these issues related to cleanliness, we have seen a huge reduction in the number of cases that are being reported in our respective hospitals as a result of the actions that we have taken on COVID. So mine is to encourage us and to say that as we move forward, some of these positive measures that we have adopted during this pandemic should become the new normal, should become the new Kenya, should become the way we move forward. And we should incorporate and build upon these as we continue, as indeed was said, to strengthen our capacities, especially in our community workers, in our health workers at the grassroots levels, to be able to help us ensure that we are able to prevent before we need to get to the cure. The other issue that I think has come out very strongly in this conference is the need for us to once again refocus on mental health care. We have seen that this is becoming an increasing problem, as I have mentioned in the past, an increasing problem in our country, amongst our people, especially our young people. There is really a need for us to refocus our efforts and redouble the work that we're doing to help and to work with the mental health of our people. And towards this end, I really want to say that it is not just the relatives or the health workers, but it is the population at large. I mean, there has been a huge impact as a result of the lockdown that we have had on our young people who have felt restrained and constrained from the liberties that they know. And this has seriously affected the health and well-being of our young people. So I think that there is need for this, and there is need for a focus on this. And towards that end, without even waiting for the national conference, I do hereby direct the Ministry of Health to begin working on an active plan that they can present to us when we have our national conference on how we are going to deal with the issue of the mental health and mental well-being of our people. The other issue that has strongly come out is the issue of the need for transparency, especially with regard to procurement in our country. We have focused heavily on some of the issues that have been raised with regard to procurement in KEMSAR and others. But I think this, as indeed was said by some of the speakers earlier, is not an issue that is related just to the health sector, but indeed to all government procurement. At the national level, at the county level, in the judiciary, in the National Assembly and Parliament, we need to work together because we have the laws. What we need to have are the systems. And again, towards that end, I also hereby direct that the Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online so that we can see who has been awarded a tender, we can see what is the value of that tender, we can see what was that tender for, we can see as they proceed, how was that tender evaluated, we can see how have people bid, we can see who was finally awarded. I think this level of transparency and through the use of technology will go a very long way towards ensuring that we have the confidence of our people, that those who are placed in institutions are able to manage the resources of the Kenyan taxpayer plus our development partners in an open and transparent manner. And I think this, as we start with the Ministry of Health, is something that we must move into all government departments, like I said, be they in the national government, the county government, or for that matter, in the various other arms of government. The Kenyan people have a right to know how their funds are being utilized.